Good morning, everyone, and welcome to the second day of the Healthcare Unscrambled conference. And my name is Vera Salzburn, and I'm honored to spend the next 5 or so minutes with you in this mental wellness moment. So we will just have a short reflection about our differences and commonalities today. So I would like to start with a story. Yesterday, we started with a poem about a dog, and today we will have a short story also about a dog. So I hope all the fish and cat and bird lovers don't mind. So the story goes like this. A lost dog strayed into a jungle. A lion saw this from a distance and thought, this creature looks edible. I've never seen this kind before. So the lion started to run towards the dog. The dog noticed the lion and started to panic at first, but then saw a pile of bones right next to him and got an idea and loudly said, right when the lion was about to attack, that was some good lion meat. So the lion stopped, surprised, and thought, whoa, this creature seems tougher than he looks. I better leave while I can. So meanwhile, the monkey on the tree nearby witnessed everything. And the monkey realized that she can benefit from the situation maybe by telling the lion what really happened and maybe getting something in return. So the monkey went to tell the lion what really happened, and the lion said angrily, "Get on my back, we'll get him together." So they started running back to the dog. And the dog saw the lion and the monkey approaching and realized what happened. At first, he panicked, but then he got another idea. And right when the attackers got close to him, the dog shouted, "Where's that monkey? I sent him to bring me another lion an hour ago." So today's meditation and today's reflection is just about our differences and about appreciating and seeing the differences in others, but also appreciating and seeing the commonalities. So the name of this meditation is Just Like Me. So I invite you to mute your microphones at first and also maybe take a comfortable position. And maybe close your eyes fully or partially, if that helps you with your focus and your attention. And maybe allow yourself to take a deep breath in and out. Perhaps releasing any unnecessary tension on your exhale. And briefly scan through your body, perhaps noticing any sensations or emotions. Inviting a sense of spaciousness and acceptance for whatever that is you may be experiencing right now. And now I invite you to bring to mind someone that maybe you don't know very well, or someone who might seem different or distant from you. Or maybe even someone whom you have a minor conflict with. And just notice as you're thinking about this person, if there's a shift in your body, in the sensations in your body. And now holding the image of this person in your mind's eye, perhaps saying to yourself, this person has a body and mind just like me. This person has feelings, emotions, and thoughts just like me. This person has at some point in his or her life has been sad, disappointed, angry, hurt, or confused, just like me. This person has experienced moments of peace and joy and happiness, just like me. This person wishes to be healthy and loved, just like me. And now perhaps take a moment to sense how you're feeling. And if you wish, maybe sending some good wishes to this person, and maybe saying to yourself, may they be well, may they be healthy, may they be happy. Now you can release the image of the person from your mind's eye. Again, perhaps returning your attention to your breath and taking another deep breath in and out. And perhaps today you can spend the rest of the day remembering that yes, while we all have our differences, we also all experience pains and joys, and we have a lot of commonalities. And if you had your eyes closed, you can open them, and I wish you all to be happy and healthy and well. Thank you.
Thank you so much, Vera, for that mental wellness moment. And to everyone, welcome to the first Healthcare Unscrambled 2021 session. We are so happy that you are here. Let's take a look here at our agenda. My name is Dewana Burke, and I'm a board member, and I'm here to give you the welcome. As you can see here, we have a very dynamic morning for you, and we'll talk more about the presenters here shortly. You can see here you have some insights on Georgians' experiences during COVID-19 we'll be talking about. Within that, we have a couple of breakout discussions, and then we're going to have a consumer panel here this morning that's going to have some great discussion for us to listen to. But before we get into our content, first, I want to make sure we take a big thank you to all of our Healthcare Unscrambled sponsors for their support during this event. And while we recognize our sponsors, we would like to get to know who's in the room today. So in the chat feature, please type your name, your city, your town, wherever you're from, and also what you're looking to get out of today's session. So for our healthcare Unscrambled sponsors, we want you to know that GFF has year-round advocacy on behalf of Georgian consumers. And if you enjoyed today's program, but have not yet given, then we hope you consider donating to our GHF today. Two other notes I want to share before we begin this morning's session is first, we're hiring, and we have 2 positions right now. So please consider joining our team or sharing this with someone who you know would be interested in either opportunity. And those opportunities can be found on our webpage under the Employment Opportunities section. My second note is during this discussion, we would love to see your video and interact with you on Facebook and Twitter using the hashtag HCU2021. And so we'll be also using the breakout feature in Zoom. So if you haven't used the feature yet, let me tell you a little something so that you won't get confused. Our partners at Spectrum Entertainment will send you a virtual breakout room twice during the session that you saw on the agenda, and it will automatically bring you into your breakout room and bring you back to the main room. So please don't touch any buttons or leave the meeting while you're in transit, because that's going to be automatically done for you. You'll have time for your interactive discussions and your breakouts, but we also want to ask that you mute your microphones while you're in the main room and when you return, just to make sure we can keep the continuity of the program and keep on time. So now I would like to introduce our next moderators for our session this morning. So first we have Michelle Conde with Georgians for a Healthy Future. And Michelle is our communications and special projects manager, where she's a dedicated health advocate with a strong knowledge and understanding of policy and research development. At GFF, she manages our external communication channels and leverages our social media for digital advocacy. She also provides policy research support and contributes to the analysis that we do for our policy efforts. Also, we have Andy Miller with Georgian Health News, and he has been a healthcare journalist for the past 25 years, and he has covered healthcare with the Atlanta Journal-Constitution from 1992 to the mid-2009. He's had numerous awards for his news reporting on hospitals and health insurers, state government, as well as Georgia's mental health hospitals. Now, I would like to turn it over to Michelle to get us started. Michelle, good morning.
Thanks so much, Delana. Good morning.
I can't tell.
Hi, everyone. So we're going to switch over to a short presentation. We're going to walk you through some data this morning. It's going to seem a little bit bleak. I want to present that caveat because we're talking about what the data says about Georgians' experiences during COVID-19. So in the following slides, we'll be looking at the trends that have developed during the COVID-19 pandemic, primarily the healthcare disparities that were highlighted during the pandemic, especially among people of color and our rural communities. Like I said, this is the data, these are the facts of our current situation, and hopefully a driving factor for everyone in attendance today to take action to help us build a healthier Georgia. So here in our first slide, we're going to take a look at the COVID-19 infections per every 100,000. As you can see, we've got 5 counties listed here. This is the wrong slide. If we could go back to COVID infections. The previous slide, it shows actually we've got Long County, Burke, Dougherty, Gwinnett, and Chattahoochee. Our yellow is the county that is doing the best right now. So Long County with 1 out of every 41 people. The red county is Chattahoochee, which is 1 out of 5 people. Unfortunately, the infection rate is very high there. And the other 3 counties you see listed are where our participants on the panel are actually from. So take a look at this map. These counties that you see in the red are gonna be popping up a lot throughout this presentation. So on our next slide, we'll see COVID-19 deaths per every 100,000. And again, we've got, the counties doing the best in the top and then the worst on the bottom, Hancock. If we could get IT to take a look real quick, it looks like folks might not be able to see the slides that we're presenting right now. I will keep sharing this though. For example, here we have Hancock County that right now has the highest infection rate per 100,000 in total deaths. Both these slides that we had on the screen show Georgia's rural communities are being pummeled by the pandemic, and we're struggling with high rates of infection and death rates. Just a reminder, if you are unable to see the slides, we have them on the program page that you received in the email, and so you can download those and follow along with us. So on our next slide, this graphic includes the demographic groups that are reported by the state and showed through December 25th, we were surprised to find this data in our research that Native Hawaiians and Pacific Islanders were the group most likely to have contracted COVID-19 and were most likely to have died right now in Georgia. And that's followed by Hispanic Latino, Black African American, White, Asian, and American Indian Alaska Native. So moving on ahead. Part of the reason that, our counties have been so exacerbated is because other health conditions made our COVID-19 outcomes much more difficult. So unfortunately, the same counties that we saw struggling now were already struggling before with a multitude of other health issues and likely struggling to access care to improve the initial issues that they were facing. So as you can see, we've got adults presenting with poor health, And it is throughout the state. Again, the regions that are struggling are very similar in each of these slides. So moving on ahead, we've got uninsured rates, which are higher in rural communities and communities of color. Pre-pandemic, there were disparities in health coverage across the state, and now we're seeing and will likely continue to see a rising level of disparity when it comes to uninsured rates throughout the state. Again, we see the top that folks in Fayette County are 10% uninsured, and then all the way in the bottom in areas in Southwest Georgia are facing higher rates of infection, of uninsured rates. So on the slide that's in front of us now, we can see Georgia's uninsured rate is unfortunately rising. We've got our communities are getting hit hard, and Georgia's already high uninsured rate is on the rise. So you can see in 2018, the total number of total uninsured adults was 1,278,000. As of May 2020, it was 1,456,000. And the percentage went from 20% to 23%. So we are already in a high poverty state, and we're facing significant job losses where folks may have had job-sponsored healthcare, and now they're being left without coverage, leading to a continued increase in the uninsured rate. Moving right along, we've got a graphic about the percent of children living in poverty. Again, this data is harsh, it's overwhelming. This is what's going on, and we need to focus on what we can do to improve it. Again, these impacted areas look very similar to our previous slides. These are the communities of color, our rural communities that are continuing to get hit by the worst of the pandemic and of the health disparities that come along with it. As we can see, we've got here a percent of adults who are uninsured because it's closely related to how children are taken care of. When adults are covered, children are more likely to be covered and receive care. So disparities among our rural communities here where children are living in poverty and struggling along with their families. So on our next slide, we'll see that poverty varies by the race and ethnicity. Again, Georgia is already a high poverty state, and with COVID impacting the economy and creating a distressing situation for hundreds of thousands of Georgians. As you can see in the slide here, again, it is our communities of color that are getting hit extremely hard and that continue to see rising rates here. So in our next slide, we're actually covering job loss. And this is actually up until April here on the data that's presented. There has been significant job loss due to the pandemic. And again, that comes along and is related to our uninsured rate. As folks are losing their employment, they're losing their employee-sponsored healthcare. And so it is, our job loss is also impacting our insured rates. As we can see, it's not presented in the slide here, but notably, women of color who have been impacted the most by the job losses, and it's actually the #1 group that has lost their employment throughout the pandemic. And this is a trend that stays pretty consistent in the percentage change throughout most counties in the state. So moving along to our pandemic pain points. And this is data provided by the Annie Casey Foundation. We can see some data from the percent of adults living with children households reporting their concerns. 15% of these Georgia adults sometimes or often do not have enough food to eat. 20% feel slight or no confidence that they'll be able to pay their rent or their mortgage on time. And 21% of these adults feel down, depressed, or outright hopeless right now. So in our next slide, we'll get a little bit of perspective on how this is affecting other aspects of the social determinants of health and how that's being intertwined with everything that's going on. Health transportation availability. GHF did an analysis using the health transportation index, and here you can see the orange are shortage areas, yellow are borderline areas, and green are areas of non-shortage areas. Again, the orange areas look pretty familiar from our previous slides. Again, these are the communities that are being hit repeatedly in multiple ways throughout the pandemic. And health transportation also took a hit in the past year. these services were previously available and already struggling, folks already had difficulties accessing them and being able to use these services, and now it's become even more limited, leaving folks in a bind. So moving on, we have our next slide. Our rural areas and communities of color are more likely to lack adequate internet access. Rural broadband connectivity has been highlighted as an issue throughout the pandemic as well, because again, so many folks are relying on the internet to stay connected to their friends, their family, their jobs, school. And unfortunately, a lot of folks don't have the right access to this. Their broadband is not up to the standard that they need it to be. And it's a lot of areas that are similar to the previous slides, areas of rural communities that unfortunately are not able to keep folks connected. So it's impacting their jobs, it's impacting their education. And our next slide, we'll see how, again, this is impacting, the pandemic has impacted education in the state. Most Georgia students are distance learning. And we have a report that as of October 2020, 56.7% of Georgia households reported that they were online distance learning during the pandemic. And we can see students of color were more impacted than white students, even when they are not distance learning. So you can see that, you know, the percentage of reporting children that were reporting that their classes moved to distance format, it's pretty similar, consistent throughout most races. But then when we moved to the percent reporting the pandemic did not impact how their children received an education, there's huge disparities among the students of color. So moving along to our next slide, this is an opportunity for you all to discuss, to see just how this data lines up with your own experiences during COVID-19, if this is, you know, the same things that we're seeing on the ground for everyone. The question that we're going to send you all out is, does this data align with your own experiences during COVID-19? What lines up, what doesn't? And a reminder for these breakout sessions, you will be sent to rooms randomly, and you will be able to unmute your mic. So a reminder to please do not disconnect when you are sent to your breakout room. It takes a few seconds to sort everyone into their virtual room. And when time is up, you'll automatically be brought back to the main room. So you won't need to press any buttons. Just join us, have a conversation, and discuss. And if you can have a representative or two from each group, come back and let us know your takes on the situation. Thanks. So now, if you can hold on to your responses, try to remember them. We will come back later after our panelist discussion for another breakout and have some time to discuss after that. But for now, I am going to throw things over to Andy Miller, the CEO and editor of Georgia Health News, who is moderating our panel with our wonderful consumer panelists today. So Andy, good morning.
Who have lived the COVID-19 experience, either in their work life or their personal life or both. They come from different areas of the state, and I think you'll find their experiences very interesting. I'll be talking to Neetha Carter, who is from Waynesboro, Georgia, which is eastern part of the state. She's a respiratory therapist and also a family nurse practitioner, and she's a single mom with 5 children in the home. Secondly, the second person I'll be talking to is Savannah White, who's a Gwinnett County teacher in the Metro Atlanta area. And she herself had COVID-19, and we'll talk about that experience as well. And the third person we'll talk to is Sharonda Powell, who is a nurse in the Albany, Georgia area, that's southwest part of the state. And we know that that was a hot spot very early on for the virus back in March. And it looks like that is becoming again a hot spot for COVID-19 here in the state, along with many other areas. So let's start with Neetha, first of all. Can you talk about your experience in dealing with COVID as a medical provider?
Yes. Actually, I work at a state facility, East Central Regional Hospital here in the Augusta, Georgia area. And in the beginning of the COVID pandemic, we were pretty good. I work in a intermediate care facility, and one part of that facility is skilled. So we had very minimal cases. We were like one of the best facilities in the state. However, we have employees that do not stay there around the clock. Our residents do. So our rates begin to rise as people continue to, I guess, convene in groups and go out on the weekends, and they would come back to work. And then we begin to see a rise in our resident rates. And we have a COVID unit and a quarantine unit. And because the rates begin to rise so high in the state of Georgia for skilled nursing and nursing facilities, they mandated twice a week testing. So we've had to twice a week test if you're over a certain percentage of employees. So we had that testing 3 times. We've had to do the twice a week testing for months. And we just recently came off of that testing so far, and we've lost them. We've lost a couple of employees to COVID-19. We've also had providers out where there were limited healthcare providers to care for the residents due to COVID-19. So it has been very challenging for us at my facility.
Describe the type of patients that are in that facility.
We work
Talk
with
about them and whether. Go ahead.
There are developmental patients, developmentally challenged, who are dependent upon their direct care staff for everything. Most of them do not talk, they do not walk, and they do have mental health. A lot of them suffer from mental health issues because they may have been people who had past traumatic or abusive experiences in life that may have put them in that situation. And so it was very difficult also taking care of them because they cannot express to you in words what's going on. So you have to be very attentive and pay very close attention to your patients as you're caring for them.
Have there been outbreaks of COVID within the patients there?
Yes, there have been. And they came, like I said earlier, from employees, because they're leaving the facility, coming back, and people still go out, have been, doing gatherings and stuff beyond the social distancing that we were asked to do. So it's coming in from the outside because there's no visitation from family, outside vendors. All that stopped the beginning of 2020 when COVID first came on the scene.
And you said that you lost a couple of employees to COVID. Do you know any? Can you describe how that impacted the caregivers there at the facility?
It was very impactful. People were very emotional because you had people who had been with the facility one as long as 25 years. It's very unfortunate. Several employees lost children, parents. It's been pretty emotional, but everybody's trying to stay positive, and we're trying to come up with creative ways of keeping everybody safe as best we can and to stop the spread.
How has it impacted you as a caregiver? Is the work harder? Is there more? Do you have to wear PPE? Describe, just the physical nature of the job versus what it was like before the pandemic.
Actually, it's pretty laid back because it's their home. So we're there to take care of them in their home. Basically, you're managing your basic medical conditions, your chronic conditions that people have. Since the pandemic, we do have to wear PPE, goggles, shields, masks, due to the increased testing in the facility. A lot of times as the provider, you're gowning up. We have a COVID unit, a quarantine unit. So it all depends on where you're working and who are you managing for that particular day. But on top of that, you still have to carry out your regular duties that are a part of your job daily. So it's been very challenging.
And you're a single mom thank you. And you're a single mom of 5 children, including a special needs child. Talk about how COVID has affected your family life, the life that you lead at home.
Thankfully, no one in my home or family has tested positive for COVID. However, it has been quite challenging. As you've seen earlier on the slides, Burke County is one of the counties, because I'm a part of a community collaborative group here, is one of the counties that does not have internet access over half of the county. There is no broadband. Back in 2018, when the governor he wrote in, passed a bill to get broadband in these areas, they have not yet started. So it has been very challenging as far as the internet part. I am a frontline worker, so I do have to work every day. And my childcare facility was closed for a period of time. So I had to rely on family and everyone to help my children and for me to get to work, because we worked a lot of crazy hours in the beginning covering for providers that were out to get their work done, and then trying to come home and complete that work. However, at the childcare facilities, when they opened, the problem was people were not prepared for the mass response of parents that needed assistance. So the internet crashed for those who had it, and the children still could not do their virtual work. So returning to school this year, and once they went back to classroom a couple of times a week, we had to go in, advocate for a lot of the students to have a lot of work redone because they could not get on, they could not complete it. And so that they would not fail, they had to go back in the system and open up work for children to go back to do to get credit. Now, my special needs son, the unfortunate part about that is I'm not sure, because everybody was overwhelmed in the school system. This special needs children were not included in virtual learning. So he has not received any virtual learning since they started. So I've had to be creative at home.
Is that
So
because,
say that again?
is that because of a lack of, is that because of a lack of broadband access, internet access? Why has he not been able
Well,
to?
Unfortunately, I just think because Burke County is so large, it's your second largest county in Georgia. You have over almost 5,000 children in the school system, with one high school, one middle school, and basically 3 elementary schools. They just were so focused on the other students, they left the special education children in special ed out, those who were, I guess, needing more services. And I guess, I don't know if they just, I'm not sure why, but they were just not included. So me as a parent and others have kind of like gotten creative and reached out to their therapists and stuff to try to get them extra help. So I think it kind of was like an oversight in a way, and then people not being trained to assist them virtually may have played a part as well.
Have there been COVID outbreaks in the schools themselves?
So far here, I think during this entire COVID experience, earlier part of last year, they had probably 3 teachers in the school system that tested positive. Didn't hear about any students, but those teachers were not in the classroom at the time. So they still did a quarantine for everyone. But as so far from that point, we have not had any notices of any other COVID outbreaks.
Thank you, Neetha. Now we're going to go to Savannah, who is a teacher herself in Gwinnett County. Savannah, can you talk about your own health situation and you know how you got the disease COVID-19?
Absolutely. And just as a correction, I don't teach in Gwinnett County. I live in Gwinnett, and I'm going to withhold what county you're in, so I don't get in trouble with anything that I say.
Sure. Okay.
But I contracted COVID from a second job that I work at during the summer. The owner of the business came to work COVID positive and did not disclose that to employees. And so we had like a little mini outbreak in our business. From that, I had it for the 2 weeks. I came back to school, the first day of school back in August, and I immediately came down with symptoms again, and they considered it a rebound. And then I essentially had it 2 times, and I had to start quarantine over again. And from there, I had it for 2 months, and I still have lingering symptoms because of it.
Now you have health conditions prior to getting COVID. Have they been a factor in how difficult it has been to kind of recover from COVID?
Luckily, it has not. I get all of my care at Emory in Atlanta, And I am so thankful that all those doctors are interconnected. So any concerns that they had about potential blood clots or any sort of damage to the heart, they all communicated with each other, and they determined that there was nothing to be concerned about.
Talk about the medical experience of being a patient, and you know, not only from the quarantine part of view, but also, you know, were there medical bills associated that were difficult to pay and things like that?
There were. So I had an injury back in July that I had to go to the ER for that was related to my bleeding disorder. And then about a month later, I had to go to the ER for a potential pulmonary embolism. So I had 2 ER bills on top of about weekly doctor's appointments, virtual appointments, COVID clinic appointments. So the bills did start adding up. Unfortunately, I'm only a second-year teacher. I ran out of sick days very, very quickly. I am at school right now. I'm at work because I don't have any more days off. And I couldn't afford to not come to work and lose money because I had about $5,000 in medical bills. Thankfully, I've had support from different organizations to help pay those bills, and I've been able to pay some of them off, and I'm working to pay the rest of them off. But it was an added stress to trying to recover. And I remember being on the phone with HR trying to understand. I ran out of sick days, and I had to go back when the doctors told me not to because I wouldn't be able to pay my bills. And it was a very tough decision to make. And I think the added stress did not help in the recovery process.
And you have health insurance through the school system, correct?
I do. And I have it through the state, and it's very good health insurance, but it still didn't cover a lot of care. I'm thankful that I work for the state and have access to health insurance. I couldn't imagine not having health insurance during that entire few months.
One of the things that a lot of people don't realize is the fact that even people with health insurance get caught in high deductibles and out-of-pocket costs, and like Savannah, face real steep medical bills at the end of the day. Savannah, how has this whole experience affected you as a teacher? Are you in a school system that's been supportive?
I'm trying to pick my words. It has been a very stressful year, a mentally exhausting year. I'm in a school system where the south side of my county feels they understand the virus. Most of those students are virtual. The north side of the county doesn't have very strong feelings about the virus. They don't necessarily think it's a problem. And we are mostly in person. I have classes of 32. And there's no room to social distance. We don't have mask mandates. Back in November, I believe, they finally mandated masks for all staff members. We still have extracurricular events. It's really frustrating being a teacher, especially one who got sick, and coming back into the classroom because it's just, you're scared. You don't want to get sick again. You don't want to bring it home to one of your family members. But the overall lack of care in our school system has pushed a lot of teachers to retire early or to resign midway through the year because we're just not being supported. We have yet to go virtual. This week, we are close to 400 cases in our school system, and we started Wednesday. So it's just getting worse, and teachers are pushing for more precautionary measures, and the school board isn't listening. We don't have our 10 COVID days anymore. Those expired for everybody. So now we're having to use personal sick days, and it's very difficult.
The 400 cases that you talked about, are they among staff members or students or both?
It is both, and it also includes transportation workers. So basically anybody that works for the school. I was telling somebody that Another reason why I couldn't take this morning off to do this at home was that we don't have enough substitutes to cover teacher absences. So they're pulling teachers in from planning periods to cover each other's classrooms in order to have enough people to watch the students. We're also pulling teachers from business or workers from the business office and HR to be substitutes in schools because no one wants to be a substitute right now. And we have too many absences to cover everybody.
With the recent surge of cases across the state, and I presume in the county where you work, is there been any talk by the administrators to go virtual to try to, to try to eliminate the danger to students and to staff members?
It depends on the school level. My school and my administration is very supportive of going virtual. They have tried to appeal to our school board and say it would be best for our school to do so. 2 weeks before our Christmas break, all the high schools in our county shut down for 2 weeks because they had a lot of COVID outbreaks, but they do not foresee shutting down any middle schools. For some reason, they can't justify shutting down middle schools. They'll shut down elementary and high schools before they do middle schools.
Thank you very much, Savannah. Now we go to Sharonda, who is, again, a nurse in Albany. And Sharonda, talk about the experience just in the Albany community of COVID, because we know that, again, it's been a hot spot early on, and then now it looks like the same thing is going on.
Yes, it is a hot spot, and I have known some of the people that have lost their lives to COVID. They like 2 weeks before the Christmas holidays, they had to close the schools down because they had so many outbreaks. So it's getting bad again, and it's due to people going out in large crowds and not wearing masks like they should, and it's just terrible.
And it seems to have hit the African American community a lot harder. Can you talk about that? Do you have any thoughts as to why that's occurring?
It's probably due to the underlying health issues that they already have. Some are overweight, some have high blood pressure. We have a lot of diabetes in this community, and we have a lot of asthma patients too in this area.
In your work as a nurse, have you had to care for COVID patients or been around COVID patients?
I have. I'm a contract nurse at a prison, and we have a medical unit that's also inside the medical facility part where I work, and the whole area is like 36 people back there. They all contracted COVID. So we had to put their whole building under quarantine. We've had to dress out in the suits, the masks, the gloves, every PPE that we can have, even down to the shields. And going in that unit, you spend about 30 minutes, and that's a long time to wear PPE that's very hot.
Now, you've had some personal losses during this time, and talk about that and the strain on families dealing with COVID infections, including the mental health issues that people are facing.
My daughter-in-law, her sister contracted COVID probably about 2 or 3 weeks prior to the Christmas holidays. Hers got so bad too. She was at the hospital. She was getting better, but she ended up having double pneumonia, and then she had a stroke to where they had to transfer her to a out of state. They had to take half of her skull because her brain was swelling. And on Christmas Eve, as my daughter-in-law was pulling into my yard, her sister passed away. And that was just like very upsetting for the holidays, and I also had a best friend that lost her sister to COVID.
And you've worked, you have experience with mental health in terms of being a caregiver, working in the community. Tell me about the strain on your community, the mental health of your community dealing with this hotspot status of COVID-19.
We have a lot of people that's just like literally scared to go and get groceries. They're scared to go pay their bills. They're just scared that if they walk out, even with a mask on, like outside of their house, that they're going to catch COVID. It's very frightening because for me also, I was diagnosed with lupus in July, right after working at a COVID testing site in Marietta, to where my coworker tested positive. And I was told, like, when he was in the hospital, but I never was COVID positive. So that was a good thing on me too. And I've worked ever since this thing started, and I haven't had a break yet.
So the burden of you as a healthcare worker is immense now versus what it was probably before the pandemic, correct?
Yes. And it's like even with our patients that we have at our facility, they're so scared that, you know, they're gonna get COVID and it's just gonna take them out. But we did have a few people that went out and were on a ventilator that did not make it back.
It's terrible. All right, I'm going to throw this out to each of the panelists, just a couple of questions for any and all of you to chime in on. First one is, as you've lived through this, how could the state or local response to COVID have been better? Are there ways that there could have been, you know, some of these problems could have been headed off?
I'll speak from the standpoint of medical. I know at our particular facility, because of COVID, they have a lot of agencies who are getting mass amounts of money to hire nurses and other healthcare workers to work at different facilities to help out with COVID that are getting like triple, quadruple their normal income. The issue that I would say that I feel is an issue where we come in is we have workers that are doing the exact same work they're bringing them in to do at our facility, and we're getting our regular pay. They're getting their 3 and 4 times what we do as we work side by side. I feel like in the state and other facilities where you have your people still working frontline, it's good to have the backup, but compensate them as well. Give them that pay as well, because you're just as exposed. You're working side by side with someone who you have to train in your facility to carry out the duties you've been doing already. So I think too, they're kind of undermining the people that are here in their local areas, teachers, frontline workers, everybody should be compensated as the same as those people they're bringing in as backup and reinforcement.
I agree. I also was one of those nurses that went and made the extra money, and I've heard a lot of people at I think it's West Central Regional in Columbus, they were saying that they're not getting the extra pay and they're working as hard. And I agree. If they're gonna work as hard as the contract nurses, they need to be compensated. Now the agency that I work for, we don't even get COVID pay anymore.
So it causes resentment among regular staff members that the temporary nurses and other workers are making a lot more.
Exactly. We have no offense, because everyone is important in the healthcare facility. We have people who are certified nursing assistants that are making more than RNs, and we have RNs that are making more than doctors and nurse practitioners, but we're working side by side them in our facility.
From a school perspective, I think we don't have clear guidelines about what to do if you test positive. it seems to change weekly about what you're supposed to do. And I know there's a group of us at the school I work at that we have a group text, and every single night we update each other on the numbers that we see on our website. Sorry, it's just something's reverberating. We have to take screenshots of those numbers because the numbers will change from day to day. And if it's 75 on Monday, when you check on Tuesday, that number has gone down to the 60s. So there's discrepancy in the reporting. We know of true positive cases in our schools that somehow don't make it onto the list of positive cases for our counties, and there's just no clear guidelines. And they had the summer to think about this and put in clear guidelines, and it's just changing per person. Somebody asked about the COVID-19 paid leave, and we have to use those days if we're exposed, or if students, like if we have students in the system who are exposed, we have to use those 10 days for that as well. So most teachers run out of them very quickly. And we have teachers working in the building whose husbands are positive and they're not having to quarantine. So it's all so arbitrary, it seems. And I just wish there was clear guidelines.
What do you all think about a mask mandate for people in public places? Georgia is one of the few states that doesn't have such a requirement.
I feel like with any type of airborne illness that can be spread, when it's this serious, I really do think when you're going in public, you have to be cautious because everyone is not in the same health. They don't have the same health status. So you have to be mindful of those that you're actually going to go around. And then there may be some people that have more than COVID, because a lot of times what you're not knowing is COVID is always coupled with something else, like the flu or whatever. Most times it's coupled with another condition. And so that could put you at risk. You don't know who you're next to. You don't know what they're carrying. So you have to be mindful of that as well, especially with our little ones in public. So to me, I think that it's just a courtesy. I think it would be a great courtesy for everybody to take care of themselves and look out for the next person as well.
I agree. Masks should be worn at all times. Even at my job, we had a nurse practitioner and a nurse that they stay in the same household. The nurse practitioner, her husband tested positive. So these are the two nurses that come to work and they never wear a mask. So then it kind of like upset everyone else in the building. Well, I don't work on morning shift, so it didn't affect me. None of those people ever wear masks. Only the night shift nurses always wear masks. So they always make, slight comments like, why are y'all always wearing masks like 12 hours? And I'm like, honey, I don't want COVID. So if, you're not worried about your health, I'm worried about mine. And you should be worried about yours when you have young kids at home, especially kids with asthma.
We know that the COVID vaccine is being rolled out now. Healthcare workers are first in line, as well as seniors and residents of long-term care facilities, and now people over 65. What is your feel? Are you hopeful that the vaccine will eventually get COVID-19 under control?
I'm very hopeful that the vaccine will get it under control, and I'm anxiously waiting for it to roll out to teachers, and I feel like that would be something that really does help. If a lot of people choose to take the vaccine, I think there's still some misinformation and education we need to do about the safety of the vaccine, and that it's okay to take and it's not going to do anything harmful to you. And I think once we overcome that barrier, more people will take it and it'll really help.
There are myths and misinformation about the vaccine that people really have to fight against, and I'm sure that's going to be a big public relations campaign, or it should be, by medical providers as well as the state. Let's move on to what this situation what the pandemic has done in your personal lives. What would you like to see happen to make the situation better for working families who are just trying to get by during the COVID-19 crisis?
I'll have to say that we hear that a lot, even in where I work. Like the young lady said earlier, a lot of people have contracted COVID. They're out of work. They're not compensated, and they do not have the days. They're not giving the people those days. So they're working, they have to go home without pay, so to speak. They have families. I think there should be some type of relief for these people who have contracted COVID, especially if you're a frontline worker and you have been exposed at work. We have had people, especially in the beginning of COVID, who all were sent home in mass amounts because they were exposed before we actually got a better understanding of COVID and how it was transmitted and things of that nature. So we had many people going home that did not get paid and didn't want to go home, waiting for test results when test results were taking 5 days to come back, that were just worrying, how are we going to make it to the next week? I see a lot of that in my community, a lot of jobs shut down, and people were forced to go home. I've seen people lose their homes because everybody did not adhere to what they said should have been carried out for COVID, as far as the rent and mortgage and stuff. So I did see people lose their homes. The shelters were not taking anybody. So I really think that we need a better response from the government as far as assisting these families. I really do.
Neitha, do you get a sense that in the community that a lot more families are going hungry or in need of food supplies, food bank help?
Yes, I can say that in my county here in Burke County, we already were what we call a food desert. So when COVID hit, it did wipe out a lot of the food banks. There were a lot of solicitation for food. I must give, I have to take my hat off to we have a big Amish and Mennonite community here. They started to have drive-by produce giveaways, 20 pounds of produce they were taking from what they harvested, because a lot of them did have a good harvest for the year. And instead of putting it on trucks and shipping it out the county like we normally do and have so many hungry families, they tried to do their best to fill in those gaps to feed people who were hungry. But we did have that. And the schools did provide meals until they shut them down for COVID as well. But Burke County still is a food desert, and that's definitely still a great need here for that.
Savannah, you have experienced financial a squeeze based on your medical bills. What would you like to see happen in that area? Because we know a lot of people are having healthcare bills, especially if they're uninsured.
I would like to see the hospitals, the business offices of the hospitals, be more responsive to what's going on. My first ER visit of the summer was not COVID related, but it was the first time I had to go see a doctor in 2020. So I was stuck with the majority of the bill, and if it was just that bill, then it would have been fine, but then everything started piling up on each other. But when I tried to explain that to the business office, they were very dismissive of the fact and only wanted to take into play my income, my monthly income, even though that number has changed since then. And that number is now being stretched further to pay for all the other medical bills and prescriptions that I have to pay for. So I'd like to see the hospital step up and come up with a system, but I know that that's a really big thing to ask from them right now. I don't know what else I'd like to see happen. Maybe some leadership at the Capitol who can address the outstanding medical debt of so many people. But I don't know if they know the answer, but I think having a discussion and opening up the conversation would be a good start.
Sharonda, you've talked about the strain on families. Is there anything that can be done to alleviate some of that in your mind?
Yes, we need more of the communities to come together and to go out and just see the needs of the people, like as far as if they need the food, if they need extra medical attention, or if they need any medicine to make it through the pandemic. I mean, we just need to find out if there are any agencies that could help accommodate these people that are in need.
All right, all of you have lived through this in your work life, in your family life. Have you had any positive experiences to come out of this? I mean, it's been a terrible time for everyone, but has there been anything that has happened that has been a benefit or been something like a ray of hope in your life?
Well, from my perspective, I was very happy to see a lot of the people come together in the community to assist other families and those in need. Also, it's very hopeful when you see the cases start to drop a lot at work and in my community. That definitely was a ray of hope.
As the vaccine gets rolled out, and you mentioned that there are some people who are hesitant to take it. I mean, how do you feel personally? Have you gotten the vaccine, and did you have any hesitancy about it?
We're still ironing out the issues where I work and in my community. The vaccine is going to be given to the residents and to medical staff that are opting in for it. However, they haven't been released yet. So we're kind of still ironing out those issues to make them available to employees and the residents there.
Sharonda, have you been offered the vaccine?
Well, they do have it to where we can go sign up to go and get it, but I'm kind of hesitant about it because I would need to actually talk to my doctors, considering that I do have lupus and other, blood disorders or whatever. So I'm waiting to get my approval from the doctor, but right now I'm hesitant about getting it because it just seemed like it just come out too quick. And that from what I've been hearing about, if you have like really bad allergies or allergic to stuff, that it's not beneficial to you. So I'm just weighing out my options, and I'm going to see how it's going to do for others before I even consider taking it.
Savannah, teachers are. Go
ahead. Sorry. We were contacted a few weeks before Christmas break asking if we would be interested in taking a COVID vaccine, but they do not have any plan for rolling it out that they've communicated to us yet.
All right. And are you hopeful to see a lot of teachers and parents, obviously people in your community get vaccinated? Do you think that will bring the rates of COVID down in your community, not only where you live, but also where you work?
Where I live, I do expect a lot of people to get the vaccine. Where I work, I don't expect a lot of people to get the vaccine. So I'm hopeful that it'll stop the spread in Gwinnett County. I'm very nervous that my community that I work in will not take the vaccine. So I think it's important that in this county we start educating our community members and encourage them to get the vaccine to help stop the spread, because it's just getting out of hand.
Is there anything that any of the three of you would like to add or emphasize that about this discussion, about what you've lived through or what you've worked through?
My suggestion to people is to always be considerate of others, whether you want to wear your mask or not. You just need to wear it because you don't know who has to go home to a grandmother, who has to go home to a parent, or who has to go home to like a newborn baby or anything like that. You just like be considerate of others because COVID is real. And until they get this under control and to where it's going to be, down, you just got to be respected of other people's lives and yours as well.
I would say everybody just make sure you're mindful. Don't just think about yourself, think about those around you. Everybody's does not have the same health status. I think it would be very beneficial to periodically go get a COVID screen, at least monthly or what have you. There are a lot of testing sites that are providing free testing to people with or without symptoms, whether you're insured or not. So I think it's a great idea for you to always keep up on where you are as far as your health, to take care of yourself as well as those that are around you.
I think, sorry, I lost my train of thought. I have students walking in front of my window. My classes just started. But I think it's important that people in communities support educators and speak up for educators, because a lot of times we cannot say what happens in the schools without fear of losing our jobs since we aren't unionized. So I think it's important for people to stand behind teachers whenever we say things. And I just so appreciate everyone and their kind words in the chat. It's been a weight off of my shoulders. And I just appreciate the support from all these people.
Well, thanks to the three of you. You've been great. Michelle, as we've heard the statements and the testimony from these three consumers, do you have any thoughts on this in terms of Georgians for a Healthy Future and the organization's advocacy and issues that it's interested in?
I think the number one thing that we have been working on for years, and that would definitely help a lot of the issues that were addressed here, is definitely Medicaid expansion. It's something we've been fighting for a while, and it's something that clearly is needed now more than ever, with so many people in our communities facing such issues with these high medical bills, with contracting the virus, and just dealing with so many health issues as well. We definitely need to make that change. It's definitely something that Georgians for a Healthy Future continues to be passionate about. We continue to fight for that every day. We have an ongoing campaign right now that I will share in the chat, where we are asking our legislators to make a New Year's resolution to resolve to expand Medicaid to take care of folks throughout the state. So we'll ask you to all to please join that, share that out, and make sure that folks in our community are participating in that campaign and asking their legislators to take action. So, thanks for the question, Andy.
No, well, we're one of the few states that have not done expansion of our Medicaid program, and we know that during this pandemic, we're seeing more uninsured. It's just, as people lose jobs. So it's a vital thing, and it's something that hopefully we can focus on and the legislature can focus on.
Yes, as always, it's something that we're gonna keep fighting tooth and nail for, to make sure that our state is covered, that we're not left behind, that the South can still move ahead and get our folks taken care of. So thank you so much, Andy, and thank you to all of our wonderful panelists. I really appreciate everyone's time today, and you were all fantastic in sharing your unique experiences and the things that you've seen out in your jobs every day. I thank you so much for sharing that and for all the work that you do on a daily basis. So now I do want to transition over to our next breakout discussion. I'm really grateful for everyone to sticking around with us. So our next question is, what did you learn from our panelists? Did their experiences line up with the data that we presented earlier? And what can you apply from their stories to your advocacy or work this year? A reminder that you'll be sent automatically to your breakout room. So please don't disconnect, as it takes a few seconds to sort everyone into virtual rooms. And when time is up, you'll automatically be brought back into the main room, so you don't need to press any buttons or do anything there. So we will see you in a few. And if you can choose a couple folks to represent your group when we come back, so hopefully we can share out results. But thank you so much to everyone for participating. Really appreciate the time you're taking right now to have these discussions. I know that it's a lot to hear right now, especially early in the morning. So we're extra grateful for that. We have a couple of minutes if anyone wants to maybe raise a hand and volunteer just to share some of the things that they heard from their group. We'd love to hear just a little bit of feedback on what other folks heard back. You know, they saw some, or learned something similar from the panelists. So there are features to raise your hand if you'd like to, or you can just quickly unmute your mic. Okay, well, I might need to call on someone. And because she was so great in my breakout group, I'm going to call on Trista from earlier and ask her to please unmute her microphone and maybe share a little bit about what you heard in your breakout discussion.
Yeah, sure. You know, I think our group, but both groups, we had great, robust discussions about what we are seeing in our communities and really the need collectively as a state to invest in advocacy for things that will help us respond to this pandemic, whether that be for school technology and assistance or transportation, or I know someone was about to have a robust discussion about the rural-urban health divide. And so I think for many of these participants are eager to continue the discussion as we move forward, especially as the session starts next week, to see how they can be engaged.
Thanks so much, Trista.
Sure.
We're actually right on time right now, so I'm going to go ahead and throw things back to one of our wonderful Georgians for a Healthy Future board members, Joanna Burke, to close us out this morning.
And thank you to all of the other panelists and moderators for this session today. And thank you for your feedback and just the discussion that we were having in the breakout session. It was really, really awesome. So if you enjoyed this session, please consider a donation to support Georgians for a Healthy Future. We are especially grateful to our monthly donors who give a little bit each month, and it's for the long haul. And our monthly donors, please join us in our final Healthcare Unscrambled session, which is next Thursday, January the 14th at 8:30 a.m., 8:25 if you want to participate in the mental wellness moment. The COVID-19 as a change maker session will also include breakout sessions. You'll be able to interact with fellow attendees and discussions, and you can glean some insights from the discussions you've learned. And we hope to see you there. So thank you again for your time, and we appreciate you joining us for our session today.